Welcome. Today we're going to talk about Medicare and Medicare supplement and Advantage plans and breaking down the differences between these and the decisions that you make at age 65 can impact the rest of your retirement years and the access and the choices that you have to healthcare. So today I have Javier Sanchez with Black Mountain Advisors, and we're going to talk about and break down the differences between these plans. So first of all, thank you for being here.
And thank you, Adam. Yeah, I appreciate the invitation as well. Excited to be here and talk to you about this really important topic for a lot of seniors in America.
It is a huge topic. And the longer I've been in the business, the more, helping people with their wealth and growing with them into retirement and beyond, there's some critical decisions and a lot of misunderstanding around this topic of Medicare.
Yeah, I would agree. Yeah, there is a lot of misunderstanding, a lot of confusion. I would probably describe it as that. As I talk to people who are in the process of turning 65, they're beginning their Medicare journey. They walk in with a lot of questions, and unfortunately, it seems the more research they do, the more questions they come out with. Which it's not to say that research is bad. Definitely, do your own research and study up on it. But it definitely helps to work with somebody who's familiar with the Medicare landscape and who's able to guide them into what is the best choice potentially for them.
Beautiful. So let's get into it. But I want to first say that if someone or love or yourself is getting close to 65, this is definitely something to pay attention to. I think what we're about to get into.
Yeah, absolutely. Absolutely, yes. Because to your point at the opening, there are consequences to making the wrong decision. So definitely start, probably 6 months in advance. I tell people it's never too early to start doing your homework, but really the ideal time is probably about 6 months before you turn 65, because that's there are some enrollment windows that are important to consider, and I'm sure we'll be talking about that.
Thank you. So maybe just a little background first. How did you get into this line of work, and how long you've been doing it?
Yeah, well, great question. Thanks. So I've been in insurance for about 20 years. I used to work on the corporate side. So there were a couple of major insurance companies that I worked for during my career. And during that 17-year period, I wore a lot of different hats, everything from sales and marketing to analytics to product management. So it was 17 very great informative years. And then about 3-4 years ago, I decided to leave the corporate world behind and take that experience that I had and bring it to consumers through my own business. So as you mentioned before, my agency is Black Mountain Insurance Advisors. I'm located here in Henderson, and I focus on commercial insurance for small businesses. So your workers' compensation, professional liability, and all the other lines that go along with that. But one market that I definitely enjoy working with is the senior community and helping guide them, helping provide advice on their Medicare journey.
Well, speaking of the Medicare journey, and we'll have a separate discussion around your other areas another time. But
sure.
for today, and I want to first start this by saying I don't think anyone's immune to the overwhelm of these decisions that, and I have seen doctors, PhDs, attorneys that get close to 65 and their head spinning. So what are the types of questions, and what's the problem when people first come to you as they're approaching Medicare about?
Yeah. So the main, or I would probably say the first confusion is really just understanding what Medicare is. Medicare is, in very simple terms, health insurance through the federal government. It's for people who are 65 years of age and older. Now, there are some exceptions where people under the age of 65, given certain conditions, certain disabilities, could qualify for Medicare. But essentially, it is that health insurance. And probably one of the biggest confusions is what is covered by Medicare. People oftentimes think that Medicare will cover all of my health care needs, and the reality is that is not the case. There are exposures, there are out-of-pocket expenses that come with that in the form of deductibles, premiums, co-payments, co-insurance, and that's where I come in to try to help people understand what those are, what those exposures are, and practical ways to try to cover those exposures as much as possible.
In the most simple terms, without an encyclopedia answer, but like what's covered and what's not?
Yeah. So Medicare, the way it comes from the federal government, you have different parts. You have your Part A, which is your hospital insurance. So think of where a person gets their health care. Inpatient hospitalization, skilled nursing facilities, hospice care. And then you have the Part B, that's your medical insurance. So think of the who and the what you're getting. So this covers your doctor bills, there's services, covers things like durable medical equipment, covers things like your lab work and your x-rays and imaging. So those are, really fundamentally what those two main parts of Medicare covers. And then there's other parts. You have your Part C, which is known as Medicare Advantage. That is sort of an alternate way that people can get their Medicare coverage. It changes up the cost sharing structure a little bit, and we can go into that a little bit deeper. But then there's also the Part D, which is your prescription drug coverage, and so that helps to cover your medications. So that's kind of the fundamentals of it.
What's not covered generally?
Generally not covered. You have there's the cost element. So with Medicare, as it comes from the government, or as I say, straight out of the box, you have deductibles that will come with your Medicare Part A and your Part B, and then you have cost sharing that comes in the form of co-payments. So, for example, if you're, just to give you an example, if a person were to be hospitalized, you're looking at a deductible of $1,736 that needs to be met before the federal government comes in and pays their portion of the hospital bill. But then if your hospital stay extends beyond 60 days, now you're looking at a per diem out-of-pocket expense, which begins at $484 per day. For days 61 through 90, and then beyond 90 days, it's $168 per day. So those out-of-pocket expenses can add up very quickly if someone happens to find themselves hospitalized for an extended period of time. There's also out-of-pocket expenses for your medical bills. So you're looking at 20%, while the federal government pays 80%. So people are oftentimes surprised to learn that those out-of-pocket expenses exist. Now, the good news is that there's ways of being able to cover that, and using plans, products that are available through private insurance companies. That's where people like myself come in order to talk about those and really help the person figure out what is going to be the best fit for them, given what they need, what they want, and their budget.
Well, there's Javier, there's a lot of research out there that says, at least the most recent research I've seen says that per person, once somebody retires and at 65 and goes on Medicare, throughout their life expectancy, they would expect about $80,000 per person for all the out-of-pocket costs. What would you say to that? Does that sound right? And is that captured in all those costs that you just mentioned?
Yeah, that's a great question. To be honest with you, I would have to see that study. Honestly, I have not read that one in particular. So that would be pretty interesting to check it out and kind of make that assessment.
Some things that I'm thinking about that may not be covered, and you can speak to that, is things like advanced dental work, elective procedures, and maybe alternate alternate medical paths,
right?
And also overseas care,
correct,
and maybe long-term care.
Right. Yeah. Good call out. Thank you for mentioning that. So yes, when it comes to Medicare, it's important to remember that it's intended to cover your medical needs. So something such as your dental work, hearing, vision work, unless it's a medically necessary procedure, will not be covered by Medicare. So that's where additional coverage needs to be provided if that's something that's important to you. And it is for a lot of people. Long-term care is another one. People are oftentimes surprised to learn that that is not taken care of. If you find yourself in a nursing home, you're probably looking at private party pay or an insurance policy if you have that. Same thing with or similarly with foreign travel. So depending on the plan, there may be some plans offer coverage for emergency care outside of the country. It's typically, but that's on a plan by plan situation. So if that's something that is of importance to one of your, consumer, to one of your audience members, that's definitely something to talk to their agent, that they should be talking to their agent about. Sure. To make sure that whatever plan they're recommending does have that coverage.
Good point. So there may be supplements,
right,
that might bridge the gap.
Yeah, there are plans out there that offer different levels of coverage. Really, and that's why probably with a lot of your viewers, they can probably relate to the fact that when they go out there and they look at the variety of options of plans that are available for Medicare, there's a lot. I mean, there's really a lot of plans out there, and the reason for that is because every plan has different levels of coverages here and there. So really finding the right one that's going to fit their particular need, that's where they should really be talking to an advisor, hopefully somebody local, somebody that they trust, that can help guide them into just kind of distilling of the hundreds of different plans that are out there, which ones make sense for them. And then from there, make an informed decision.
Okay. Couple questions here. Mm-hmm. What does it matter what state you're in?
It does. It does matter what state you're in. So definitely, you want to find a plan, or make sure that your broker, your agent is recommending a plan that is suitable, or that is within your state, and again, that's suitable for your needs. Now, depending on a person's lifestyle, maybe they do a lot of traveling, within the United States. Maybe they have multiple homes in different places. So all of those are factors that should definitely be taken into consideration when picking a plan. And again, those are things that you want to have a conversation and let your agent know that those things are important when they're recommending a plan option.
Does predisposition to certain health issues impact your choices as well? Like if you have diabetes or an autoimmune disease, for instance?
It can. Adam, it certainly can. So there are plans out there that are designed for people with certain chronic conditions. That is also part of the conversation that I have with clients, and people should have this conversation with their agent as well, because those chronic condition plans may have coverages and benefits that will be useful to that individual. So basically anything that involves a lifestyle as well as existing conditions. Now, one thing that's important to know is, and this question I get it a lot as well, or not a question but a concern that I get a lot, is regarding pre-existing conditions. When you're 65, when you're aging into Medicare, you are within a guaranteed window. So so it's important to know that whenever someone is within a guaranteed issue window, they don't have to worry about those underwriting rules. But depending on the decisions that they make as they're or after they've turned 65, then at that point, they may or may not be within a guaranteed issue window. So those are important conversations to have with an advisor. As you're turning 65, know what you're going into. And then after you've turned 65, if you find that you need to make a change into a different type of a plan, to understand what those, what those guaranteed issue windows are, if they still exist, and what your options are in that case.
Now, Javier, I think one of the examples might be if somebody chooses Medicare Advantage, then they may not be able to switch into a new plan if they have certain health issues. Right?
Yeah, and that's exactly what what I was referring to as well. So so when you turn 65, you have that guaranteed issue window where you can go into a supplement. That window is you generally have a 12-month window. Beyond that 12-month window, then you're most likely going to be in an underwriting review. Mm-hmm. So then at that point, the insurance company can decide to take you or not take you at that point. So that's why it's very important to weigh, really what's important to me as a consumer. What do I reasonably anticipate I'm going to be needing? And, and also making sure that whoever is advising you, is providing you with that guidance, is explaining the pros and the cons, the potential downstream effect of whatever decision you're making.
What is, Javier, the biggest decision or mistake that people make when they're choosing their plan at 65 right off the get-go?
Yeah, I would probably say the biggest mistake is not working with someone. Yeah, not working with a local agent who they know, who they trust, who asks the right questions and provides clarity in their answers. It's important to know that there is no plan that offers coverage for everything. There's always going to be a trade-off. So when I'm getting something when I'm getting something over here, what am I losing over there? So it's really important that the person who is providing you with that advice, with that guidance, is explaining the pros and cons of each of the options, so that when you make a decision, you're making an informed decision.
Can you give an example of how that works and maybe a common trade-off that you see?
So one example might be, for example, with Medicare supplement plans, you typically have a higher monthly premium than you would with, let's say, an Advantage plan. But you have greater flexibility in that you're not bound to a network of doctors. So that flexibility is actually is a very valuable feature for a lot of people, especially, again, going back to a person whose lifestyle has them living part of the year in another part of the country, like a snowbird or somebody like that. With an Advantage plan, you typically have lower premiums, or in some cases no premium on a monthly basis, but you're paying co-payments as you're getting your services. But with Advantage plans, because they are what's called managed care, they typically function within a network of doctors, and there is typically a referral process that's involved when getting additional healthcare, specialized healthcare, specialist, or some kind of a procedure that's done. So that's an important trade-off to understand thoroughly, and to make sure that you're okay with that trade-off.
Is it, Javier, fair to compare Medicare Advantage to an HMO?
So Medicare Advantage plans come in both an HMO and a PPO format.
Okay.
The PPOs give a little more flexibility in that you can see out-of-network doctors, and you may not necessarily require a referral in order to see a specialist. And I say may not because, again, it all varies by plan, so it's important to look at each plan specifically. But the HMOs and the PPOs, they do function in that managed care format. One just gives a little more flexibility in being able to see doctors out of network and without a referral. Whereas a supplement plan functions outside of that whole network framework. So with a supplement, as long as the doctor takes Medicare, you can pretty much see any doctor anywhere in the United States.
Okay.
Yeah.
So if somebody chooses the Advantage plan and then they like a year later, they're like, hey, this wasn't a great option for me because the whole network thing.
Right.
Then when can they switch?
Yeah, so they generally have to mind that window. So that 12-month window is very important to be aware of, and then it's also important to be aware of the election periods. So you can't, you generally can't switch in and out of a plan at any time. There are election windows that need to be where the change needs to happen. So you have the annual enrollment period, which runs October 15th through December 7th. And this allows you to make plan changes for the upcoming plan year. And then you have another election window that runs from January 1st through March 31st, in which a person has the ability to make a change. And then beyond that, there are special election windows, which are really on a case-by-case basis. I mean, really, this person has to, be able to qualify for a special election period. So it's just important to know what that window looks like in general, and then how that's going to apply to you. So again, that's a conversation that your agent should be having with you if you are, in that area where, you want to try the Advantage plan, but the possibility of a supplement down the road is still in scope. So it's just very important to have that conversation with your agent and make sure that, that you're aware of what that timeline looks like and how it would specifically apply to you.
Just a quick question here.
Mm-hmm.
You mentioned agent, and then you also mentioned one of the mistakes people make was maybe not working with an agent. Right. Does it cost money to work with an agent?
That's a great question, Adam.
Is there any downside?
There's it doesn't cost the individual anything at all. So my clients don't pay me directly. I get compensated through the insurance companies, and the compensation structure through Medicare is all standardized. So people should feel, they should rest assured knowing that when I make a recommendation, the recommendation is really based on what I genuinely think it would be to the benefit of the client. It costs them nothing more to have an agent versus to not have an agent. And then furthermore, I would say, look for somebody who is local. It's really important to have people who are familiar with the healthcare landscape in your area. Do they know the doctors? Do they know the networks? Do they know, the various facilities and providers that are out there? When you work with somebody local, they have more, they'll probably have a better sense of that landscape in your area, and they'll be able to just provide you that extra value of being able to point you in the right direction if and when it's necessary. Whereas if you're working with somebody maybe who's across the country, then that could be a little more challenging for them to have that sort of that intimate knowledge of what's going on in your neighborhood. Yeah.
If somebody is in Nevada, about how many different plans are there?
That's a great question. I would say I don't have an exact number because it is well over 100 different plans.
Oh my goodness!
Yeah.
How do you do research on 100 different plans if you're going into Medicare?
It just requires that's it's for the average consumer. That's a very daunting task for the average consumer. As someone in the field, I do my research. I know who the companies are. I know who I'm contracted with, and I know who I'm not, and so I'm able to survey that landscape, and by having a conversation with a prospective client, then at that point that begins to give me the information that I need to begin to distill from the options. You discard the ones that don't make sense for this individual, and you're left with with a handful of options that do make sense with this individual. And then as the conversation continues, then we just kind of whittle away at the options to present 2 or 3 viable options. Really, I think when it comes to your healthcare, if someone is presenting an option straight out the gate, I would say perhaps beware, because when it comes to your healthcare, there is no one size that fits all. That's why there's so many plans out there, because every plan has, a slight variation that's intended to satisfy a specific need within the market. So definitely work with someone who is asking questions about what you're looking for, what you want, and is not offering a blanket solution out the gate.
Okay.
Yeah.
Great advice.
Yeah.
So if I were to think of this at high level, there's the decision. There's two major decision points, right? Isn't it 6 months, or leading into your first decision of choosing a plan, and then there's the annual enrollment window, or possibly to revisit the plan.
Right. Absolutely. Yes. Yeah. Without a doubt. So, the 6 months is, I say, start thinking about this 6 months out. Your initial enrollment period actually begins 3 months before the month of your birthday, includes the month of your birthday, and then extends 3 months past the month of your birthday. So a person has a total of 7 months around their birthday where they're able to enroll in Medicare. They're able to make that initial enrollment into Medicare, and within that window also work with someone to select a plan that makes sense for them. And then beyond that, yes, they have those election periods where they can make a change. Generally, it makes sense to have your plan reviewed annually. So for the most part, for people who are on Advantage plans, that October 7th through that October 15th through that December 7th window, that's generally the time to talk to your agent about the changes that are taking place in your plan for next year. And at that point, decide, does it make sense to stay in my plan for next year? Or does it make sense to, find something that's a better fit for me? So that's definitely that window of opportunity to do that. For people who are on supplement plans, that window is typically on your anniversary date. So if you turn 65 in May, you got your supplements effective May 1st. That's a great time to revisit your plan and see, if does this plan continue to make sense for me, or is there one that maybe is a better fit for me, or is it going to save me some money? So that anniversary date for people on supplements is also an important time.
Just so I'm clear, you mentioned the example of May birthday, and then the anniversary. Is it the anniversary every year?
Yes, absolutely. Yeah,
for supplements.
For the supplement, correct.
Okay.
Yeah, because with supplements, you have the ability to your opportunity to switch to another supplement, or stay within the same plan but just with a different insurance company, is your anniversary. So you have a 60-day window beginning in the month of your birthday in order to where you can decide to stay with your current plan or to make a change to another plan. Now, again, there are some rules in that, so definitely talk to your agent about that. But generally, that's the window of opportunity that you have to revisit your current plan option.
So for supplements, it's around your birthday,
correct?
And for Medicare Advantage, it's the enrollment window, October 15th to December 7th.
Correct.
Okay,
that's right.
Great clarification.
Great, glad.
So what are like the top two things that you see where causes or prompts a change?
So every year, Adam, we get older.
Yeah.
Every year there's, things tend to, in our bodies tends to deteriorate, unfortunately. So as our health needs change, it's important to reevaluate if your plan continues to be the best fit given your current health needs. And then there's other factors. There's the financial factor. My budget has changed, maybe. So at that point, if your budget's changed, okay, and perhaps if your current plan is no longer fitting whatever your new budget situation is, then that's another trigger to say, okay, let's reevaluate what we currently have.
So, and I'm just thinking of a possible scenario. So one scenario might be drug costs, or you're going to specialist visits a lot,
right,
and those copays are adding up. Then and maybe it's weighing on their minds that, hey, this is costing me a lot of money. Then there could be a solution to save money,
absolutely,
by changing plans.
Yeah, absolutely. Okay. Yes, that's a great great example. With respect to drug costs, it's important to know that besides our own situation, there is also just the general outside, the macro situation of healthcare. Healthcare costs tend to go up every year. Inflation, tends to go up every year. So all of that has an impact that not only affects us personally, but also affects the insurance companies that are providing our prescription drug plans and our healthcare plans. So with that being said, it's possible to have medications within the plan formulary that are no longer covered at the same level that they were before. So it's very possible for a
That's
medication
probably
to
changing
go
all the time, isn't it?
right. Right. They can very well go from a tier 1 to a tier 2 or to a tier 3. So medications can migrate within the plan formularies, and so the impact to the consumer is that maybe that medication is no longer covered to the same level that it was before. Same thing with your plan. You might have a plan where the copayment structure is no longer the same. So now that has bearing on whether or not the plan makes sense for the individual. Now, the good thing is that those changes are announced to policyholders on a yearly basis. So plan members get what's called an annual notice of change in September that tells them what their plan is going to be covering or what kind of changes are taking place in their plan for the upcoming plan year. Same thing with formularies. The formularies will oftentimes change every year, and so the insurance company is required to notify their insureds. But also, more importantly, having again, going back to the importance of having a trusted local agent, having somebody who has that regular contact with you as a client and as a consumer is very important. I reach out to my clients on an annual basis, and depending on the kind of plan that they're on, I'm reaching out to them either ahead of their anniversary date or ahead of the annual enrollment window. Once we all know what is taking place for the upcoming plan year, to have that conversation, to understand, okay, how has the plan worked out for you this past year? Here's some changes that are taking place with your plan for the upcoming year. Does it, how is that going to affect you? And thirdly, are there any other plans out there that might be a better fit for you? So those are conversations I have with everyone. Those conversations can be maybe a simple 10-minute conversation. It may be an hour-long meeting. So it varies on a case-by-case basis, but it's definitely very important to have somebody who is proactive, or working with someone who is proactively reaching out to you as a client and making sure that conversation happens.
What usually leads to regret, like where somebody regrets their choice?
I've seen regret in when they've found out that maybe a particular doctor is not in their plan, or maybe a particular medication is not covered. So that can come as a surprise to people, especially if maybe if either they made the decision on their own, or maybe they were working with someone who maybe didn't do all of the due diligence in making sure that doctors and medications were covered by the plan. But unfortunately, that does lead to some regret in their selection.
I can imagine, somebody getting a health situation, whatever it might be, cancer, or they go through, chemo and all the treatments, and maybe there's some, ongoing drugs that are needed. What triggers underwriting if you're switching plans? You mentioned that earlier, but
sure.
Like, is that leaving Advantage, or is that going to, or is it just any change? Yeah.
So generally the way the rule works is as follows. When a person turns 65, they are within a guaranteed issue window.
Yep.
With the supplement plan, if they are already in a supplement, the state that they live in, like for example, Nevada, has what's called a birthday rule, where you can switch from a supplement plan with like or lesser coverage without undergoing underwriting review. So that birthday rule gives them that guaranteed issue for a brief period of time. So those are, that's an example of guaranteed issue, a couple of guaranteed issue windows that people should be aware of. So if that is something that is important to them, if that prognosis is in the back of their mind, which I've had clients for whom that has been in the back of their mind, those are definitely conversations that we have. And my clients are well aware of what those windows are, how it's going to impact them, and what to do if we got to that point where we wanted to make that change without having to undergo underwriting.
Okay.
Does that answer your question?
Yeah. So I don't know tell me if I have it right, but so if a certain time of year, you can switch from one supplement to another if it's equal.
Correct.
Or comparable.
Yes.
But not necessarily switch to Advantage.
Correct. If the Advantage has the enrollment window that runs from October 15th through December 7th. So if a person is on a supplement, they wish to move to an Advantage, that is the main window that they have in order to make that change.
And once they're in Advantage, if they want to go back to a supplement, there would generally be underwriting.
If their time within the Advantage exceeded that 12-month window, which is often referred to as the free look period, if they have exceeded that 12-month window and they wanted to go back to a supplement, then at that point they would have to undergo underwriting. If they wanted to go back prior to the end of that window, then they're still within their guaranteed issue period. So they can go back into to the plan they had, or to the same supplement they had, or a supplement with lesser coverage without undergoing underwriting.
Okay. So if we took a step back, you mentioned an example of like if somebody travels or if they have needs, then they might want a supplement. But what type of people tend to do better with supplements versus Advantage?
So this is generally, you have, I would say that a person who, they have to have, I always look at three things, going back to what I mentioned before. There's the person's needs, there's their wants, and then there's their budget. With supplement plans, it's important to know that those come with a monthly premium. Now, so this is above a monthly premium in addition to the Part B premium that they're paying to the federal government either straight out of their Social Security check, or if they're remitting payment to the government every month. But that premium may be completely out of budget for some people. So that right there is
that's a factor.
could potentially be a game changer for many people. So I would say that's one, and then the other one is, if the lifestyle is going to warrant, it doesn't merit, having the level of, that level of coverage. So again, if they frequently find themselves traveling, especially for extended periods of time, if they're snowbirds, if they have family in other states who they're staying with on a regular basis, and they have doctors in those other parts of the country, or maybe they want the flexibility to just be able to see a doctor if they needed to in those other parts of the country, then it could very well warrant having a supplement or a particular type of Advantage plan, like a PPO, maybe that would probably offer that broader coverage. So again, it's it's not to make a blanket generalization. That's definitely something that they would want to talk to their agent about, but those are some potential scenarios where someone may want to consider some the broader coverage that comes with a supplement or with a PPO.
Sure. Okay. I mean, the way I'm seeing it is that the supplements, you have more flexibility, but there's more cost potentially.
Correct.
And with the Advantage, people might be attracted to that because there's less cost involved.
So the cost is, there's generally a lower monthly cost, because with Advantage plans, you either have a lower monthly premium or perhaps even in many cases here in Nevada, no monthly premium with many of the plans. But you're looking at co-payments as you're receiving your service. So think of it as a pay-as-you-go kind of a framework. So So if a person is a low utilizer of their healthcare, then it could be, it could potentially save them a lot of money. But if they happen to have a year where they're visiting the hospital a lot, going to the emergency room a lot, getting a lot of procedures done, then at that point, that's where the co-payments, begin to come in.
With Advantage.
With the Advantage plans,
it
right?
adds up like the $50, the $100.
Yep, yeah. It could. And, so it's important to know when you're evaluating the different plan options, it's important to look at what's called the summary of benefits. That's a document that Advantage plans provide that gives you the breakdown of your co-payments depending on the procedures that you're getting. So going into the plan what your co-payment would be if you were to see a specialist, if you were to need, if you were to get an MRI, if you were to go to the emergency room. It breaks all of that down for you so you know ahead of time what your out-of-pocket expenditure would be in the event that you needed that service. There's also a very important number in there, which is your maximum out-of-pocket. So the maximum out-of-pocket is the most that a person would pay during the year in co-payments. Beyond that point, the insurance company pays all of your medical co-payments beyond that. So I like to call it sort of like a safety net, so to speak, because it tells you what the most will be in your outlay in medical co-payments during the year. But again, all of that's very important to weigh all of that against. Okay, so I'm looking at this on the Advantage side. What is this going to be on the supplement side? And again, just make that do that. What could be potentially simple math, and just figure out what makes the most sense for you.
Javier, how the difference between supplements and Advantage? How do they behave in a major health event, like that, where you're going to spend a lot of time in the hospital, need a lot of treatment? Is there any huge differences between the two? There
may be. There's a lot of that will depend on what exactly we're talking about.
Yeah.
But there could be differences in how that's covered. Trying to think of an example that, looking at, let's say, you're hospitalized. Let's say this person is, goes to the emergency room, which then turns into a hospitalization visit. You have an ambulance. You'll have an ambulance co-payment. You'll have potentially an ER co-payment, which may be waived in some instances, may not be waived. Then you have, your admittance into the hospital, which may come with a co-payment as well. So, those points, each of those co-payments begins to add up. And of course, it gets applied to whatever the maximum out of pocket is for the plan. Whereas on the flip side, with an Advantage plan, you might have, let's say, the monthly premium, but with some supplement plans, you have the monthly premium, but depending on the supplement plan that you have, you may not have to worry about those co-payments. How it plays out, there can be two very different ways of how those things play out.
What's as we're wrapping this up, what's one or two, you mentioned work with an agent, you mentioned local. Is there any other major advice that you would give in helping someone think about a long-term choice or as they're preparing or thinking about these decisions?
Yes, I would say have questions. One, going back to, seeking advice. Yes, working with somebody who is who you feel comfortable working with, I think really is key. When you're looking for an agent to kind of guide you in this Medicare journey, treat it like a job interview. That person is, what qualifies that person to give you advice? What are their credentials? And do I feel comfortable working with that person? So those are important questions to ask. Also ask questions such as, does this plan cover the conditions that I have? Or how does it cover the conditions that I have? How do I feel about the out-of-pocket expenses, whatever they might be, whether it's the premiums, deductibles, co-payments, the co-insurance? How do I feel about those? And do they fall within my budget? And are there any other benefits or coverages that I'm looking for that are covered or perhaps not covered by this plan? So I think just asking all the right questions and working with somebody who is knowledgeable, I think will probably take care of a large percentage of the bad experiences that are out there, or not even the bad experiences, but just help to provide that comfort, that peace of mind that many people are looking for.
If somebody wants to reach out to you, Javier, what are a few questions you might ask them?
It's the first interaction that I have with people, it's really about them. And my questions are typically very open-ended. Tell me about you. Tell me about your, what you currently have. Tell me about what you're looking for. It begins with that. And then from there, we begin to drill down.
Perfect.
Yeah.
And the whole conversation might last how long?
It could last anywhere from 20 minutes to well over an hour. It just depends on how the conversation goes and how much the individual opens up and shares.
Well, Javier, thank you so much for
pleasure.
being here
Thank you,
today,
Adam.
for sharing some insights. You being so close to this topic, it really helps to be able to discuss it with your knowledge and expertise. So,
well, thank you, Adam. I appreciate the opportunity to be here. I enjoyed being here, as a matter of fact. So thank you again.
Thank you, Javier.
All right.